Do you know what is the #1 cancer killer for men in their 40s? If you guessed prostate cancer, you'd be right, and that's why it's important for men in their 40s to know the risk factors, the warning signs, and what they can do to reduce their risk of developing this potentially deadly disease. I am a urologist and pelvic surgeon, and today we were going to talk about prostate cancer in men in their 40s. If you're new here, I am a board-certified urologist, and I make educational content on sexual health, bladder health, and much more. So if you like what you see, make sure you share this with your friends. So let's talk about prostate cancer in men in their 40s. Why are men in their 40s at risk for prostate cancer? Well, prostate cancer tends to be a very slow-growing cancer. However, as it grows, it can become life-threatening. That's why it's so important to detect it early when it's still small and contained and has not spread outside of the prostate. Typically, prostate cancer does not cause any symptoms early on, and by the time men are experiencing symptoms, it may mean that the cancer has spread outside of the prostate into the bones or other organs. That's why screening is so important, and it's recommended for men who are at average risk to begin screening around the age of 50, but men who are at higher risk may need to begin screening earlier. So who are those higher risk men? Well, those are men who have a family history of metastatic prostate cancer. So if your father or your grandfather or a brother had metastatic prostate cancer, meaning cancer that spread to other parts of the body, then you may be at higher risk and you may want to start screening earlier. Also, if you have a family history of prostate cancer on your mother's side, specifically if a male relative had prostate cancer before the age of 65, then again, you may be at higher risk and you should consider screening earlier. Also, African American men are at higher risk of developing prostate cancer and having more aggressive disease, and so they should also consider screening earlier. Lastly, if you have a first-degree relative who had prostate cancer, again, these are your parents and your siblings, and they had it at any age, then you should consider talking to your doctor about whether you need to get screened earlier. So what exactly is screening? Screening tests are simple blood tests that we draw to check for a substance called PSA, or prostate-specific antigen. And this is made by the prostate. And when there's an increase in PSA levels, it could be a sign of prostate cancer. However, it's not specific for prostate cancer. It can also be elevated with other conditions like prostatitis, an enlarged prostate, and even low testosterone. The next part of the screening is a digital rectal exam, or DRE, which is a very quick, easy test where a doctor inserts a finger into the rectum to feel the prostate to make sure there aren't any nodules or abnormalities in the prostate that could be concerning for cancer. And if either of these tests are abnormal, then we move on to what's called a prostate biopsy. A prostate biopsy is a procedure where we take small samples of the prostate under ultrasound guidance, using a needle through the rectum to obtain those samples. And those are sent off to pathology to look for any presence of cancer. Are there any other screening tools? There is a new screening tool out there. It's called the 4K score. This is a blood test that looks for different biomarkers or substances in the blood that may help predict the risk of prostate cancer. The problem with this test is that it's not widely available and it's quite expensive. And so at this time, the standard screening remains the PSA and the digital rectal exam. So what can you do to lower your risk of developing prostate cancer? Well, there's no proven way to prevent prostate cancer, but some of the things you can do to help prevent other cancers may also help prevent prostate cancer. First and foremost, eat a healthy diet with lots of fruits, vegetables, and whole grains. Exercise regularly and maintain a healthy weight. If you are overweight or obese, losing just 5 to 10% of your body weight can make a big difference in reducing your risk of developing prostate cancer. Lastly, avoid smoking. Smoking increases the risk of many cancers, including prostate cancer. So if you do smoke, please talk to your doctor about ways to help you quit. Okay, I hope you guys found this helpful. And if you did, please comment below and let me know if there are other topics you want me to cover. As always, remember to take care of yourself because you're worth it.